So, what does shockwave therapy actually look like treating a men's health condition like erectile dysfunction? I'm going to show you, not myself, on the model anatomical penis. So, first of all, we would be using what we call the standoff, which is the end that goes on this machine, which is built for men's health. So, the shockwave therapy machine that we have is literally designed for this treatment and comes with this specific end. As you can see, it's curved, it's nicely shaped round onto the end of a penis. So, we normally would do 1500 to 2000 shocks, and roughly speaking, it would be 500 right onto the base, 500 right into the shaft, and 500 into the perineum. At that point, we would use a different what we call standoff on the end, which would actually send the shockwave in a little bit deeper, so we affected the correct tissues in that area. As I would have said before, this treatment is non-invasive, so it's not going to be breaking the skin. It's painless, so most men saying they don't feel a thing. Certainly people not saying that they feel lots of pain during the treatment, so it's really positive in that sense. So in terms of actually the mechanism of how this works, within the penis here, we've got what we call smooth muscle, and it's that smooth muscle that's going to respond to the shockwave and actually improve its contractile function so that we've got the tension within that muscle to hold the blood in and not let it escape. It's within that escaping blood that things then start to drop back down. We've also got arteries that come through, which become narrowed and become calcified with age and diabetes and our blood pressure and all these things. And the shockwave going in is actually going to break down those calcifications. It's going to encourage new blood vessels in the area, which are all going to promote the ability for this to be able to stay up and hold that blood in there, hold an erection. The muscle tension that we're talking about as well affects the muscles just above and just below, and that tension balance that we need is why we treat just below into that area. So that's a little bit about how we do shockwave therapy for erectile dysfunction and other men's health issues. If you want to see the full video series, which answers all the questions, commonly asked questions that people have about this, then literally just below this video there's going to be a link. You're going to go onto a similar looking page, but that's going to have the full video series. I hope that explains all of your questions. If you want to chat with me one-on-one on a video or a voice call, then that's absolutely fine. There'll be a link on that page or this page for you to be able to book that up. If you feel like you're ready to come in and you want to have a proper men's health consultation, get to the bottom of what's going on and start to work on a diagnosis and a treatment plan, then there's going to be a link for that too.